You've probably heard of a urinary tract infection, or UTI, right? I mean, they're super common. But have you ever wondered what happens when that seemingly simple infection decides to travel? When it escalates from a minor annoyance into a full-on battle inside one of our most important organs? Well, today, we're diving into exactly that. We're talking about pyelonephritis, the kidney's hidden battle.
Okay, first things first, let's talk about that name, pyelonephritis. It sounds super intimidating, I know. But it's actually just some simple Greek words smashed together. Pyelo refers to the pelvis, not your hip bones, but the kidney's own little collecting basin. Nephros simply means kidney. And you've probably heard itis before. It just means inflammation. So, put it all together, and it literally means inflammation of the kidney's pelvis. See, not so scary once you break it down.
So here's our game plan for this explainer. We're going to start with the basics. What even is a UTI? Then, we'll look at the two main ways an infection can actually get in. From there, we'll follow that invasion as it travels upward and see what happens, the real damage, when it finally reaches the kidneys. And we'll wrap up by looking at the key risk factors that can kind of leave the door open for these invaders in the first place.
All right, Section 1, what exactly is a urinary tract infection? Well, at its most basic, think of it as a breach in your body's security system, specifically along the pathway that urine takes to get out of your body.
Now, this is really important to get. UTIs aren't all the same. There are two main battlegrounds. You've got your lower UTI. This is the one most people are familiar with. It's an infection down in the bladder, which is called cystitis. But then you have the upper UTI. And this is a whole different ballgame. This is when the infection has climbed higher, all the way up to the kidneys. And that is pyelonephritis, the serious one we're focusing on today.
So that brings us to Section 2. How do these little bacterial invaders manage to get inside and cause all this trouble? Well, it turns out there are really only two main ways they can pull it off.
And when you look at the data, it's not even close. A whopping 85% of kidney infections are what we call ascending infections. That means the bacteria start low and literally climb their way up. Only a small sliver, about 15%, get there a different way, by traveling through the bloodstream from an infection somewhere totally different in the body.
So who are the culprits? Who are these invaders? Well, for that huge 85%, that upward route, the number one bad guy is usually E. coli. But here's the crazy part. This isn't some exotic bug from the outside world. It's a totally normal resident of our own gut. Now, for that much rarer bloodstream route, the offender is usually a different character altogether, typically Staphylococcus aureus.
This brings us perfectly to Section 3. Let's actually trace the journey of one of these ascending infections. Let's follow this upward invasion from the outside world all the way into the kidneys.
So this whole invasion really happens in 3 stages. It all starts with step 1, bacteria from the gut area manage to contaminate the opening of the urethra. From there, if they're not flushed out, they can creep up into the bladder, causing that classic bladder infection, cystitis. That's step 2. Now, if the body's defenses can't contain it there, the bacteria just keep going, marching right on up into the kidneys. And that's the final, most dangerous step, pyelonephritis.
Hearing about this whole upward invasion process, it naturally leads to a really common and really important question. Why are women so much more likely to get UTIs, and by extension, pyelonephritis?
And the answer really just comes down to basic anatomy. There are two big vulnerabilities. First, the female urethra is just a lot shorter than the male's. That gives bacteria a much shorter, easier path to climb to get to the bladder. And second, there's proximity. The urethra is located really close to the rectum and the vagina, areas that naturally have a lot of bacteria, which just makes that initial contamination step way more likely.
Okay, on to Section 4. The bacteria have made it. They've won the early battles and have finally reached the kidneys. So what happens now? Well, the battle that unfolds can go one of two ways. It can be a sudden, sharp fight, that's acute, or it can become a long, grinding war, and that's chronic.
An acute infection, a sudden attack, it really hits you out of nowhere. You'll get classic signs like a pretty bad pain in your side or back, plus a fever. It can sometimes be triggered by things like sexual activity, which can introduce bacteria. That's where the old-timey term honeymoon pyelitis comes from, or even by pregnancy. But here's the good news. With the right antibiotics, an acute infection usually clears up pretty fast.
But what if those acute attacks just keep happening over and over again?
Well, that's when you start wandering into the really dangerous territory of chronic pyelonephritis. And this isn't just a temporary illness, it's a slow, destructive process. Every single infection causes more inflammation, which leads to permanent scarring of the kidney tissue. And in the worst-case scenarios, all this damage can eventually lead to end-stage renal disease, which means the kidneys just fail completely.
And if you want a picture of just how intense this damage is, pathologists actually have this really striking term for what a chronically infected kidney looks like under a microscope. They call it thyroidization. What that means is the kidney's tiny, delicate filtering tubes get so scarred and swollen and transformed that their structure actually starts to look like tissue from the thyroid gland in your neck. It's just a powerful, kind of weird visual of how profoundly the organ gets changed by these repeated infections.
So what makes a person susceptible to this whole destructive cycle? Why do some people get these infections over and over? Well, that brings us to our final section, the key risk factors that can seriously weaken the body's natural defenses.
You know, our bodies are pretty smart. We have this brilliant defense mechanism, a set of one-way valves that are supposed to stop urine from ever flowing backward from the bladder up toward the kidneys. The single biggest risk factor for severe pyelonephritis is when this system fails. The condition is called vesico-ureteric reflux, or VUR. And when you have it, it basically creates an open highway for bacteria to travel directly from the bladder right up to the kidneys.
Now, beyond VUR, there are other things that can really cripple our defenses. Any kind of blockage in the urinary tract, like a kidney stone, creates stagnant pools of urine where bacteria can just thrive. As we've already covered, being female is a risk factor, just because of anatomy. Conditions like diabetes can weaken the entire immune system's ability to fight back. And even medical tools like urinary catheters, while necessary, can unfortunately act as a direct doorway for bacteria to enter.